Bernice Abubedu. Thanks for your company. In our first story, crucial evidence in the ongoing investigation to establish how injections at the new Senchi Health Center killed 4 persons has been seriously tampered with, according to joint news sources at the Food and Drugs Authority. The disease control officer, James Yeboah, who administered the injection, has been arrested together with the head of the health center, but the mixture used for the injections could not be retrieved. Medical superintendent at the VRA hospital, Dr. Seth Fiadoyo, said when he visited the health facility, he asked Mr. Yeboah to keep the mixture for forensic investigations.
Around the middle of March this year, precisely on the 11th, on the 17th, and on the 18th of March, 1 patient, respectively, on each of these days, was brought in to our OPD, reporting of infected buttocks after injection. The injections were given at a center called New Senchi Health Center. The report was made to me from the hospital on the 18th, on Sunday. So the following Monday, after the morning clinical meeting, we had a brief on the issues about the 3 patients, and it was quite serious. So I called the district director of health services, informed him about what was happening, and then told him I was going to the center to halt all proceedings there until further notice. He agreed, and so I went to the new Senchi Health Center, and upon interrogation of the workers there, I got upon one Mr. Yeboah, who admitted administering the injections over a period of time to about 15 to 20 patients. He showed me a sample of the solution he was using to dilute the powder of penicillin V, but I didn't see any constituted medicines available. I asked him to withhold any more procedures, keep the solutions and the mixtures safe for forensic medicine, for forensic lab testing, and so reported back to both my director and the district director of health services, in the hope that we will get the specimens for lab tests and no more patients would be involved in this very sad episode. As far as our administrative policy was concerned, that's what we did. But typically it was the surgeon and our gynecologist who were involved in the management of the patients. You know, normally if you have a post-injection infection, you simply go, cut the area and take out the pus and monitor with antibiotics and supportive therapy to heal. But you hear from the surgeon that these were very devastating destruction of tissues, large areas necrotic with what we thought were both fungal and microbial mixed infections. And so we tried a lot, put them on multiple wide range antibiotics and supportive treatment, but unfortunately out of the 3 we've lost 2 so far.
Now, the other 2 persons who died died in Akuse and Ho, bringing the total number to 4. But you just had the medical superintendent at the VRA hospital, Dr. Seth Fiadoyo. We'll get you more details on this shortly from a man who's been on this beat, Manasseh Azuriawuni. But 2 people have been remanded in police custody pending investigations into the matter.
The court, presided over by His Worship Seth Alafa, said the issue of murder was not a matter that could be heard by the magistrate court. The 2 are to appear in court on 2nd May 2018, pending a fiat from the Attorney General. Meanwhile, a Sujaman District Health Director, Abdulaziz Abdullahi, says that the detention of the 2 became necessary following a DISEC meeting.
So eventually, I was tasked to make a formal complaint to the police regarding the injection abscesses and subsequent deaths that occurred. So on Thursday evening, I lodged the complaint, and then the police invited the man in the center of the issue, the one who gave the injection, accompanied by the physician assistant in charge of the health center. And so, upon report on Friday with them, the police detained the 2 of them for investigations. And this morning, that is the 3rd of April, the 2 were arraigned before court and have been remanded in prison custody to aid the police in further investigations.
According to Abdulaziz Abdullahi, the new Senchi Health Center has not been closed down as widely speculated. Any ailment that will require injection is, however, to be handled by officials in other facilities in the district.
Because the problem that occurred is injection related, and also since we are yet to determine what really accounted for the abscesses and the results of the deaths that we got, I issued an instruction to the facility to withhold or stop all manner of injections at the facility until further notice. So as we speak now, since last week, there has not been any injections given at the facility. If there should be any injections given, I have directed that it should be sent to other facility for intervention.
Let's speak to the man who's been following this keenly, Manasseh Azuriawuni. He joins me for more on this, especially on how the evidence is not available to the FDA's investigative team. How did this happen? How did we lose the evidence, Manasseh?
What we are told is that when this happened, they went there on the 19th. That's the director, the medical superintendent of the VRA hospital on the 19th, asked him to preserve whatever was there for forensic lab testing. But nothing was done, or nobody went in until last week Friday when they were arrested. And so the sources that the FDA said when they got in there, they didn't find the solution. They didn't even find the remaining chemicals. That's the penicillin that was being used. So they could not get it. So it is suspected, or they think or suspect this has been cleared, and the people put their house in order even before the investigators went in there.
Tell us how this affects investigations.
Benis, this affects the investigation in a number of ways, because now the FDA statement points to the fact that the water used, there's a special water used for mixing the drug. They suspect that may have been contaminated. And so if that was found, they could test and then be able to tell exactly what went wrong. But now they cannot find that one, and they can also not find the penicillin that was being used to be able to get to the bottom of this.
So what are they relying on now for the ongoing investigation?
For now, what we know is that some samples have been sent to labs. That samples from the bodies of the deceased and affected persons have been sent to the lab, so they are waiting for the result. They have also collected some empty penicillin bottles, we are told, about 200 or more of that. and they are trying to test and find out whether those chemicals were in good condition or not. We are also told that they got the man to tell them where he got his suppliers from. So he mentioned about 3 different suppliers, and we are told the FDA is doing everything possible to trace these suppliers to be able to ascertain whether what they were supplying was in good condition or not. So beyond the primary evidence, this is what they are also relying on.
Manasseh, we also have some information about the mixture rate, and the health authorities were raising some questions about the percentage, for example, of penicillin he added to the special water that you talk about. Yes,
what we are told is that there's something they call saline, and it is a particular liquid that I'm told they use for drips and the rest. From what a medical doctor friend told me, beyond what we have been gathering, he said that if you get the penicillin, it's supposed to come with its liquid. It's powdered form, but it has this liquid that comes with the supply. So you take it, get the liquid, and do the injection. But in the absence of that, they use other waters, maybe special water, let me put it that way, medically, for mixing the penicillin for the injection. And normally they mix about 10, or they use 10, between 5 and 10 milliliters, very small quantity. And once you open it and use it, you are not supposed to keep it and reuse it.
The water?
Yes, because it could be contaminated. But in this case, from what we are hearing from Dr. Fiadayo, the superintendent at VRA Hospital, this man mixed 500 milliliters, and we are told he used it over a period of time. So it is suspected that once there is a contamination, if you continue using it, you could hurt the other individual. So this is how the situation came about. But at the time they spoke to him, they were told that he had used about half of the 500 milliliters. So there was half left. And about 20 people are said to have received injections from that same mixture. That is what he told the medical superintendent, that he injected between 15 and 20 people. But sources within the district are saying that this number could have been more, and they suspect he may have toned down on the actual number that he injected with. So they fear or suspect more people may have been involved in this that they do not know. And those fears are grounded because when we first got to the district last week, the health authorities knew of only 3 cases, 2 deaths and then 1 who is still recovering. But when we asked around, we were able to establish 2 others, and those 2 people have died. 1 has been buried and the other is yet to be buried. Manasseh, the question that beats my mind is, this disease control officer, was he supposed to be administering injections in the first place? Have we heard anything from the Ghana Health Service? The Ghana Health Service has not spoken yet. We've tried everything to get to the bottom or ask some of the critical questions. But what we are told is that they are still doing investigation. But from what we hear from health authorities very close to this incident, he was actually operating a dermatology clinic alongside. It's like a CHIPS compound of a sort. So he has a place he operates, and that, according to what we are learning, his operations there in the first place is illegal. It is not sanctioned by the health authorities, and in their records, it is even not there. So it's like he has some relationship with whoever manages the place. So he sets up, attends to patients, and whatever happens there does not go through the official records of that health facility. Manasseh, finally, there's another person on admission at the VRA hospital. Any updates on how she's doing? Yes, this is a woman, and the doctors, we are told, did a good job on her. I mean, the doctors at the VRA hospital, they did a very good job on her because they learned, they got a trend. They are still yet to establish what happened, but they got a trend from the first 2 cases they looked at. And so what they did was, instead of cutting the area that was infected, they actually went deeper or beyond the immediate surroundings of her buttocks where she had the problem. So they said that really saved her situation. So we are told her vitals and everything is responding. She's responding very well to treatment, and they hope she will be able to survive.
Thank you very much for the updates. Manasseh Azuria winning there. This is a story that he's been following keenly, and will bring you updates as and when they are available.